closing the hole in the heart. Now, where we are going from here, how far we have progressed in the cardiology, interventional cardiology department is that now we can almost replace all the heart valve without opening the heart. That is to the transcatheter approach, like how we do for the angioplasty. So, but not all patients can be, we can replace the valve or we can close the leaks of the valve to the transcatheter approach. Those patients who have very high risk for surgery, as Dr. Rakesh has mentioned before, that they require, they have liver problem, they have kidney issues, they have neurological problems, very elderly patients, but still they have a right to undergo the right treatment, they have a right to live, and therefore these are the very higher end procedures, also known as structural heart disease, which is my keen interest other than doing routine angioplasty. So I am going to highlight about a case what we did in Manipal hospitals. It's the first time it is done in Goa. It's, mind you, this higher end procedures don't come under DDSSY because they are very costly procedures. Don't be under the impression that the insurance, these are basically very higher end procedures, high risk surgical procedures which cannot be covered under a routine government scheme. So patient has to either spend from his own pocket, they are costly, or they may be having some private insurance. So I'm just going ahead with the case. So he was a 77-year-old male with significant cardiac history. He had undergone a bypass surgery in 2001, multiple angioplasties in 2004, 2011, 2021. He had multiple comorbidities like diabetes, liver cirrhosis, portal hypertension, which was recently diagnosed in November 2024. So how he came across to me, what happened exactly in February 2025, this year, he was admitted with breathlessness and swelling of the feet. And he was diagnosed with a condition known as heart failure, where the heart is unable to pump blood forward into the aorta, which Dr. Jyoti has basically demonstrated before. So in August 2025, his symptoms started worsening, that is, he used to become progressive breathlessness in spite of optimal medical therapy. So he came to me and I did a 2D echo, that is the sonography of the heart, and also had a doubt, so we did a transesophageal echo, that is what Dr. Divya mentioned, is we have to put a probe inside the esophagus, because the esophagus is more closer to the heart, so that we can get a clear view of what is going on inside the heart. And there we came to know that the patient had a severely leaking valve known as mitral regurgitation. I will come to you what is the leaking valve in the subsequent videos. So the treatment decision was taken. Open heart surgery deemed very high risk due to the age, advancing age and multiple comorbidities. Family consent for hence, as he was a candidate for open heart surgery, it's a heart team approach, it's not my own decision. We discussed, this is my entire heart team, including the imaging specialist, the cardiac surgeon, the cardiac anesthetist, and a non-invasive person. So it's the heart team procedure, and we discussed with the relative that if the surgery can't be done, then this particular procedure has to be done. This procedure can be done inside the cath lab. It is done in the cath lab where we do a routine angiography and angioplasty. So the family was counseled for transcatheter H2H repair, also known as a TEER procedure, using MyClip device. MyClip is a clip which clips the leaking valve. I will show you in the subsequent video. And it is manufactured in India. MyClip is the first recently launched clip which is manufactured in Vapi, India, and is exported all over the world. And we are doing those procedures very well. So the TEER procedure was successfully performed on the 6th of September, this month only, at Manipal Hospital. First such procedure in Goa, and also in the entire Konkan region. The patient's heart, what was most important that till now, before the availability of MyClip, the only option was to open a heart, put a clip across the leaking valve, and then send the patient home. But this requires a very morbid surgery, high risk. The recovery time is delayed for almost 1.5 months, lung complications and so all. The beauty of this procedure is that patient goes home either in the 3rd or 4th day. There is no incision, nothing, just a keyhole.